Let's look on the next page, page 98. Page 98 shows, we looked at it before the break, this is showing the sympathetic innervation to the very same visceral organs. Again, now, as you look more carefully, and you can see this labeled at the bottom of the page, the solid black lines, we now know, represent the myelinated preganglionic fibers, and the dashed lines represent the unmyelinated postganglionic fibers. So again, just like we saw on the previous page. So now you're starting to understand why they drew some solid lines and some dashed lines. Now, two things about this picture. What the hell is this? You'd say, I don't know, it's just on the picture. Let's ignore it. Keep moving. A large number of the sympathetic myelinated preganglionic fibers synapse in this thing right here. This thing right here, that's right on the side of the spinal cord, is called the sympathetic chain ganglion. It is known as the sympathetic chain ganglion. And you'd say, what is this thing right here? And I'll kind of just highlight it. And this is where many, not all, of the sympathetic preganglionic fibers synapse onto sympathetic postganglionic, represented by the dashed lines. So I want to show you a couple pictures of what the hell we're talking about here, the sympathetic chain ganglion. This is more anatomy than physiology, but you know, there is an anatomic reality that we wanted to point out. Let's look on page 102. On page 102, this is the picture we were learning. This one feels pretty comfortable. So here it shows the sympathetic innervation. Can you see that this sympathetic myelinated preganglionic fiber is synapsing right here? This thing represents the sympathetic chain ganglion. Again, not all sympathetics do this, but a large number do. The sympathetic chain ganglion. That's what this thing is right here. And I want to show you just a couple more pictures of this. Okay, we're going to go all the way back to page 26. Page 26. And again, what I'm about to show you is not that important. It's really more anatomy than physiology. Just want to draw your attention. This is page 26. This was the very first page of the nervous system. All right? This was our introduction of the nervous system. And I want you to notice that shown right here on the sides, on both sides of the spinal cord, what does it say? Right there. Sympathetic chain ganglia. So whatever the hell this is, it appears right there on the very first page when we first introduced it to you. Look on the next page, page 27. The next page, page 27. Let's look at the bottom picture. Remember this? Some of you might even remember this from, you know, an anatomy class. All right? You'd say, okay, so what? That's the spinal cord. Here's the spinal nerves coming off. Let me draw your attention. Look at this. Running on both sides of the vertebral column, there they are, the sympathetic ganglia. See that? So they're in all the pictures. This is where many of the sympathetic preganglionic fibers synapse onto a sympathetic postganglionic, right near the spinal cord. So that's why on this picture on 102, it shows it real close to the spinal cord. Let's look at one more picture. And the other picture I want to look at is on page, well, with two more pictures. On page 99, this is our composite picture. And so that's what this thing is right here. This is the sympathetic chain ganglion. And it says it right here. It says it. I'm just trying to explain what it is. It's not that, am I going to test you a lot on that? No. And one last picture. Let's look on page 103. Page 103. This is page 103. And you'll notice here's the spinal cord going through the vertebral column. And look what's running on both sides of the vertebral column, this sympathetic chain ganglia. So it's there, whatever the hell it is, there it is. It's in all these pictures. And that's where a lot of the sympathetic preganglionic fibers synapse on the sympathetic postganglionic. Now, a couple of other things before we move forward. Let's go back again to page 98. Back on page 98. So we said on page 98, the sympathetic nerve fibers come off at what level of the central nervous system? The sympathetics? The thoracic and lumbar levels. Did everybody see that? So in contrast, the parasympathetics come off at the cranial and sacral levels. Go back to page 65. 65. On page 65, this was page 65. Remember this? We were learning the spinal cord. And we learned, and hopefully this makes more sense now, what's in the dorsal gray horns. That's where the sensory neurons synapse onto inner neurons. What's in the ventral gray horns. That's where the somatic motor neurons originate. And now let's look at what I wrote about the lateral gray horns one more time. First of all, where are the lateral gray horns? They're only located at the thoracic and lumbar levels of the spinal cord. You should go, And what is it? It's the location of the sympathetic preganglionic autonomic motor neuron cell bodies. At the time, when I mentioned this on page 65, when we mention it on 65, we just wrote here, oh yeah, that's an autonomic motor neuron originating in the lateral gray horn. But if you look more carefully, it is the location of the sympathetic preganglionic autonomic motor neurons. I just kind of skipped all that because we hadn't yet learned it. So that now you know exactly what type of neuron, and that's why these come off only at the thoracic and lumbar levels. I'm just trying to put some loose ends together. Now, one last kind of thing I want to mention. Again, let's look on page, page 98. 98. All right, page 98. This is again, the sympathetic innervation of our internal organs. So this is showing that there is sympathetic innervation to the iris of the eye, and the airways, and the heart, and the sympathetic innervation of the stomach, and the sympathetic to the intestines. Here's the sympathetic innervation of the kidney. What's this above the kidney? What's that above the kidney? That's the adrenal gland. Is there a sympathetic innervation to it? Well, it shows something going to it, but there's something weird. Everywhere else it shows a dashed line. Remember, there's a solid black line followed by a dashed line. The myelinated followed by the unmyelinated. Why does this one just show a solid black line? There's no dashed line. There's something weird going on with this adrenal. It had no parasympathetic innervation, and the sympathetic looks different than any other organ. Let's discover the real secret of the adrenal gland. Let's look on page 102. All right? So here is the adrenal gland. This is page 102. We're just looking right here. Now, The adrenal gland. The adrenal gland consists of an outer and an inner part. Let's talk first about the outer part of the adrenal gland. Now, the outer part of the adrenal gland is called the adrenal cortex. The word cortex means what? What does cortex mean? It means the outer part. What do we call the outermost part of your brain? The cerebral cortex. Cortex means outer part. What do we call the outer part of the adrenal gland? The adrenal cortex. Now, the adrenal cortex is an endocrine gland. It secretes many steroid hormones into the bloodstream. Endocrine glands secrete hormones into the bloodstream. These hormones, which we're going to learn more about, are collectively, these hormones secreted by the adrenal cortex are collectively called adrenal corticosteroids. If I could spell the word, adrenal corticosteroids. Why are they called adrenal corticosteroids? Because they are steroids secreted from the adrenal cortex. How's that? For short, they'll just call them corticosteroids. We're going to talk about these steroid hormones. There's 3 classes of steroid hormones secreted by the adrenal cortex. That we'll get to. That's coming up when we get to endocrinology. We are going to finish up nervous system. We are getting close. I promise to finish the nervous system before March. All right, now. So we'll talk more about them. They are secreted in the bloodstream. Let's focus on the adrenal medulla. The adrenal medulla. Now, what does medulla mean? The medulla means the inside, the inner part. The inner part of the adrenal gland is called the adrenal medulla. What do we call the innermost part of your brain? The medulla or medulla oblongata. The inner part of the adrenal gland is called the adrenal medulla. What is the adrenal medulla? It is a ganglion. It is a ganglion made up of neurons. You'd say, well, what do you, how, what? Okay. There is no parasympathetic innervation to the adrenal. We saw that. There was no parasympathetic. But there is a sympathetic, but it looked different from anywhere else. Now, before I explain this, let's just look above to the heart. In the heart, we have a sympathetic, myelinated, preganglionic fiber that synapses onto a unmyelinated sympathetic fiber that releases what neurotransmitter? Norepinephrine. Now, what if I just had a picture that just stopped right there? So here, what I'm trying to show you is imagine we have a sympathetic myelinated, and it synapses onto this sympathetic neuron in a ganglion. That's what this is. You'd say, what do you mean? Here is the sympathetic myelinated neuron. Follow it out. And what is it synapsing onto? The sympathetic, these are sympathetic postganglionic neurons. This is a ganglion. This was a ganglion. What is that? That's a sympathetic postganglionic neuron. These are sympathetic postganglionic neurons. You'd say, well, say that again. Okay, I'll say it again. Say, you didn't even have to ask me. Here's a sympathetic myelinated neuron synapsing onto a sympathetic postganglionic neuron. Is that okay? Here's a myelinated sympathetic neuron synapsing onto sympathetic postganglionic neurons. These are sympathetic postganglionic neurons. Now, what do normal sympathetic postganglionic neurons? Normal sympathetic postganglionic neurons have an axon, and it releases what neurotransmitter? Norepi. Imagine if this neuron didn't have an axon. Just pretend it didn't have an axon. And imagine instead of releasing norepinephrine, it released a modified form of norepinephrine called epinephrine. So these are sympathetic postganglionic neurons that have no axons. You'd say, let me write that down. Slow down. I wrote it for you. I wrote it for you. The adrenal medulla is actually made up of specialized sympathetic postganglionic neurons that have no axons! And they release a modified form of norepinephrine called epinephrine. And they release it into the bloodstream. So, this really now is a revelation because it explains something kind of that should have been bothering you. In biology classes and maybe even anatomy classes, you always learned adrenaline, epinephrine. Oh yeah, that's a hormone. Well, the definition of a hormone are chemicals that circulate in our bloodstream. And epinephrine or adrenaline is a chemical that circulates in our bloodstream. But I told you on page 61 that dopamine, norepinephrine, and epinephrine are neurotransmitters. And nobody ever said, well, wait a second, I always learned it was a hormone and you say it's a neurotransmitter. Because it is a neurotransmitter hormone. These are neurons releasing epinephrine. Those are neurons releasing the neurotransmitter epinephrine. But the reason why they release it into the bloodstream is they have no axons. They release it into the bloodstream. So epinephrine, also known as adrenaline, is a neurotransmitter produced by neurons, released from neurons, but it circulates in our bloodstream as a hormone. It is a neurotransmitter hormone. Now, you'd say, this is so weird. Actually, as we're going to be learning, there are many neurotransmitter hormones. When we get to the hypothalamus of the brain and the pituitary gland, we're going to learn there are many neurotransmitters that are secreted into the bloodstream and act as hormones. So this is going to be a theme that we develop further. It's more common than you think. Because the nervous system and the endocrine system are interwoven. It's called neuroendocrinology. All right, so it's a neurotransmitter hormone. So that really explains what epinephrine is. Now, what's the purpose of it? Well, we know that epinephrine chemically is very similar to norepinephrine. They're both catecholamines. We learned that back on page 61. And the purpose of this, as I wrote on page 103, so the epinephrine is released into the bloodstream, and thus it affects all the visceral organs of your body and the brain. So normally a sympathetic neuron would release norepinephrine right onto the heart, right onto the stomach, right onto a salivary gland. But these sympathetic neurons release a modified form of norepinephrine called epinephrine into the bloodstream, so it affects all the organs of the body at once, even your brain. And the purpose, as we wrote, is to amplify, to exaggerate a sympathetic stress response. So sometimes, you know, if I just unsuccessfully frighten you, and you're startled, and then you go, that's that stupid teacher, he's just trying to throw a chair around. But the thing is that if I startled you and your heart rate speeded up, it may take a few minutes for your heart rate to slow down. Even though your sympathetic neurons to your heart have already stopped releasing that norepinephrine, which speeded up your heart rate, epinephrine was released into your bloodstream, and it's going to affect your heart and your other organs, and even how alert you are in your brain for a number of minutes afterwards. So it exaggerates or amplifies your stress response, the epinephrine. All right, so now we've discovered that. Okay, now we're getting to really the most important aspect of the autonomic neurons. This diagram, I think, is important to get a handle on. This one right here. It's very simple. whether we have an essay question on this or not, there will be multiple choice questions. Now you might say, well, I'm not an artist. You know, Professor Fink, you're not much of an artist. You couldn't draw that. Yeah, let me show you how you draw it. Is that basically it? And then you just label parasympathetic, sympathetic, what neurotransmitter does this release, what neurotransmitter does that release, what does this release? We know the answers already. You got a 3 out of 4 chance of getting it right just by saying acetylcholine. And this one releases Norepi. Now, that's not a complicated, does that take a, you know, but isn't that the essence of what this picture is right here? Right? Because this is all we want to do, and in physiology, we don't care about art. That's why I didn't need to know art to be a physiology person. We want to understand what it's doing. And this is pretty much encapsulates it. Now, let's get to the real stuff. Let's look on page 105. This you do need to know. This is a essay subject for sure. We need to know both sides of the chart. The good news is, if we learn one side, the other side's just the opposite. Okay, it's the nice symmetry of the body. So I find that it's easiest to understand the stress state because I guess we feel a lot of stress. The whole bottom line of what the sympathetic response is, the stress response, is to provide more energy. And another way of saying that is ATP. You say we're back to APP? Yeah, that's right. Now, how do we produce energy, right? And again, keep in the context that this is an emergency state. We're running. We're frightened. This could be life or death. This is a life or death situation. We're in combat. So we need more energy. We produce ATP by breaking down foods with oxygen. Is that how we make ATP? So what do you want to have happen to the level of sugar in your bloodstream? Raise it. The muscles, our heart, our body needs more sugar to produce more ATP. Now, where is most of the sugar stored? In the liver as glycogen. So we're going to see glycogenolysis occurring. Lysis means the breaking apart, we've learned this before, of glycogen. As the glycogen stores are broken apart in our liver, they are broken apart into glucose. The glucose is released into the bloodstream, and that raises our blood sugar level. When we're in an emergency state, when you're in combat, when you're frightened, your blood sugar level rises. Now, not only do we want to use sugars for energy, we're going to use fats for energy. This is what happens when you go to the gym. You get on that treadmill, and you're going to start burning sugar and fats. That's what it's going to take. Now, so where's the fat stored in our body? In our fat cells. It's stored as triglycerides, and those triglycerides are going to be broken apart into fatty acids and released into the bloodstream, so we can burn fats. So that's called lipolysis. Lysis, or breaking apart of fats. So we're releasing fatty acids from our fat cells. We're releasing sugars from our liver cells. The sugar level's going up in the blood. The fatty acid levels are going up in the blood. We're going to start, we got more foods now to break down for energy. Now, generally we want to produce ATP aerobically. We need oxygen. Now, I did put here that during stress, your rate and depth of breathing increase when you're running. Now, I put this in brackets because we know the control of our diaphragm muscles, intercostal muscles, they're really skeletal muscles. They're controlled by somatic motor neurons, not autonomic. So this is not technically autonomic response. So I put that in brackets. It does happen during stress, but it involves somatic motor neurons to skeletal muscle. This is the diaphragm muscle. This is the diaphragm, which is a skeletal muscle. So this is really not an autonomic response, it's a somatic response. But I did want to mention that it does happen. When you exercise, you breathe faster and more deeply. Why? To provide more oxygen. Now, something that is autonomic is when you're in a stress state, you need more oxygen for cellular respiration. Your airways dilate. The airways widen. They dilate to deliver more air. And that is autonomic, because autonomic motor neurons control dilation and constriction of these airways. Another interesting thing is that during a stress state, you secrete less mucus. There's less mucus secretions everywhere. Your mouth goes dry, your nose goes dry, and your air. This was our chart, a possible essay question, that compares and contrasts what happens to your body in the stress state versus what happens to your body in the rest and digest state, page 105. And this is really important to know for a lot of reasons. It's important to know what's going on inside of a body when they're stressed. It's equally important to know what's going on inside their body when they're eating a meal. And furthermore, as we're going to see, we have drugs that can mimic either of these states or block either of the states. So this is going to be really important pharmacologically as well as physiologically. The good news is if you learn one side, the other side is ostensibly the exact opposite. So all you really have to know is one side of it and the other side's the opposite. We started out by saying that really all these words on the top of 105 basically mean the same thing. Sympathetics are activated during a stress state. They release catecholamine neurotransmitters, including norepinephrine and epinephrine, which activate the adrenergic receptor sites. So these are, referring to slightly different things, but it's all tied in with the sympathetic stress state. The basic challenge in stress, whether it's fear, whether it's fighting, whether it's running, is to provide increased energy to meet the emergency situations. If you're running for your life, you sure as hell are going to need more energy to power up your muscles. If you're fighting somebody, hand-to-hand combat, you better power up your body, your muscles, so you can fight. If you're frightened, you better deal with, you're going to need extra energy to manage this situation. These are emergency situations. They are possibly life-threatening situations. So you're really going into what we might call a survival mode, a survival modality. This could be it. So the main goal here of the sympathetic response on your internal organs is to provide more energy to your body in the form of ATP. ATP is the gasoline that powers our cells. So this isn't what the sympathetics do. This is the purpose of this response. All right? They don't cause increased. In other words, the purpose of it is of the sympathetic is the increased need for energy. So what the sympathetics are going to do is increase the availability of that energy. How do they do that? So remember, we've got all these autonomic motor neurons innervating all of our internal organs, the liver, the stomach, the heart, the kidneys, the blood vessels. So as I tried to describe beginning last time, if you were going to design the human body, what would you want your body to do, the different organs to do in an emergency situation that we've described? So the sympathetic effects on your liver is to cause your liver to start breaking apart the stored glycogen back into glucose and release that glucose into the bloodstream to provide more sugar for the muscles and other active tissues of your body. So the sympathetic effect is to promote liver glycogenolysis. That raises your blood sugar level, and that provides the ability of your active cells, including your muscle cells, to have more sugar to make ATP. Not only, your sympathetics also innervate the adipose tissue, fat tissue. So stored in our fat cells, we learned all this way back in section B, are triglycerides. So the sympathetics promote the breakdown of triglycerides into fatty acids and the release of fatty acids into the bloodstream. So in this emergency situation, your blood sugar levels rise, your fatty acid levels rise. This just provides the nutrients needed to make ATP. Now, we know that in cellular respiration, that's the process by which you break apart sugars and fats and other foods using oxygen to make ATP. So there's another ingredient we also need to increase the availability of, and that's oxygen. So one of the things that happens is in a stress state, you start breathing faster. Now, I did point out last time that this increased rate and depth of breathing to take in more air, to take in more oxygen, this involves your diaphragm muscle. Your diaphragm muscle, the most important skeletal muscle, is controlled by somatic motor neurons. So this is really not an autonomic action. This does not involve autonomic motor neurons. That's why I put this in brackets. So I want you to know what happens, but that's not part of specifically the autonomic response, the sympathetic response. But what is part of the sympathetic response is that your sympathetics do innervate the muscle in the walls of your airways, and it causes the bronchodilation, causes your airways to dilate. Now, in your book, if you were to look in your book, you will see that I have a big chart, and it lists every internal organ, and it tells you which type of adrenergic receptor is on each organ. I have not done that for every organ here. I did do it for airways. So I am telling you that the type of adrenergic receptor site on airways are called beta-2 adrenergic receptor sites. There are 4 that I have specifically asked you to know, so those you do need to know for the test. I'm not asking you to know the type of adrenergic receptor site on fat cells. It's called a beta-3. I'm not asking you to know it. I have somewhat arbitrarily, but I think for good reason, chosen the 4 that I think are most important. Look, I could be mean. You'd say you are mean. Okay, I could be even meaner and just have you memorize them all. And when you take your future pharmacology courses, they probably will make you memorize them all. All right, but our goal is just to get an introduction to this. All right, so so the sympathetics dilate the airways. That helps facilitate or take in more air at a faster rate to make more oxygen available in your bloodstream. Another thing your sympathetics do is they cause the mucus-secreting cells to decrease bronchial secretions. And in fact, your sympathetics, as we started to say last class meeting, basically decrease mucus secretions everywhere in your body. They decrease mucus secretion in your nose, they decrease mucus secretion in your airways, they cause a drying out of your mouth. So all your air passages basically dry out. And perhaps the reason for that is in order to take in large amounts of air, we just don't want to clog up any of our airways or risk clogging them up with extra fluid or mucus. So this is perhaps just to facilitate taking in large volumes of air rapidly. Now, so far we've talked about raising sugar levels in the blood, raising fatty acid levels in the blood, increasing oxygen availability to the blood, all that's needed for cellular respiration. Now the next task is for your heart. The job of your heart, as we learned way back on page A3, was when we first summarized what the function of each of the systems of the body, or the function of the cardiovascular system, is to distribute oxygen and nutrients to the cells of the body. So now it's up to the heart. Okay, that sounds good. Okay, so it starts to beat faster and faster and faster to push the blood through the vessels of the body at a faster and faster rate. That delivers the sugars and fats and oxygen to the tissues that need it at a faster and faster rate. So the heart beats faster, and that's called tachycardia. And in case there's any question, do we have to know that word? 100% yes. Tachycardia means increased heart rate. Not only does your heart beat faster, but it beats more powerfully. You can feel your heart pounding inside your chest. And that's called an increase in myocardial contractility. That just means increased force of contraction. And again, in case there's any question, like, do we have to know that word, myocardial contractility? Emphatically, 100% yes. It means increased force of contraction. You must know that term. It appears everywhere in physiology and pharmacology books. Now, I did ask you to also know that the adrenaline receptor sites that are on the heart are called beta 1. Notice that those are different adrenergic receptor sites than those on the airways. Now again, norepinephrine, epinephrine would activate them both. But we have drugs that can activate just the beta 2 or just the beta 1 adrenergic receptor sites. So, and we will talk about those drugs as we go on. Now, the next challenge, and incidentally, this increased rate of contraction, tachycardia, the increased force of contraction, increased myocardial contractility, increase your cardiac output. That just means that your blood flows 2 or 3 times faster through the vessels of your body than normal, than when you're sitting. So that's delivering those nutrients at a fast rate. Now, the next challenge is where to send that blood. And you might say, what do you mean? You have about 60,000 miles of blood vessels. You don't have to know that number. Just be impressed that you've got 60,000 miles of vessels in your body. But you only have 5 or 6 liters, 5 or 6 quarts of blood. 5 or 6 quarts of blood cannot possibly fill 60,000 miles of vessels. So you have to decide, always, at any moment in time, where could you reduce the flow of blood and where should you increase the flow of blood? In most emergencies, the way we deal with most emergencies usually involves running, lifting things up, using our skeletal muscles. So where we want to increase the flow of blood is to our skeletal muscles and also to our heart, because our heart is a muscle that's working harder. So those vessels dilate. Dilating the vessel increases the blood flow. They open up wider, and that increases the flow of blood with oxygen and sugars and fats to these active muscles. Now, where could we reduce the flow of blood? Where it's just not absolutely essential that where we could reduce the amount of blood. I'm not saying shut it down to 0, but where could we reduce it? Because it's not absolutely essential in terms of life and death emergency situations. How about the GI tract? And how about the kidneys? If you're running for your life, do you really have to digest your meal at that moment? Do you really have to finish, absorbing your nutrients? Or could you save your life first? Somebody's shooting at you. Could you at least get out of the way of the bullet and then worry about digesting your meal? Could you wait in filtering the blood by your kidneys? Could that wait for a little bit until after the emergency has passed? So these vessels constrict. Constricting means they get narrower, reducing the flow of blood, and that reduces how much blood is going to these non-vital organs, at least in terms of this emergency situation. Now, one of the questions we might ask is, how is it possible that norepinephrine, the neurotransmitter norepinephrine or epinephrine, how can they dilate the vessels of the skeletal muscle but cause the other blood vessels of our body to constrict? And the answer is because it's a slightly different type of adrenergic receptor site. We actually originally talked about that way back on B25. At the top of B25, remember this diagram? All right, this is where we first introduced this concept of a drug that mimics a neurotransmitter or hormone and a drug that blocks, right? Mimetics are also called agonists and blockers are also called antagonists. But I want to focus on this middle picture right here. In this middle picture, it shows, and nobody ever asked me about this back on B25, it shows epinephrine can bind to receptor sites on blood vessels. Some blood vessels have what are called alpha or alpha-1 receptor, adrenal receptor sites, and other blood vessels have what are called beta or beta-2 adrenergic receptor sites. When epinephrine activates the alpha receptor sites, what does it show the blood vessel does? It constricts. But when epinephrine activates the beta receptor sites on different blood vessels, what does the blood vessel do? It dilates. So the effect of how it is that epinephrine causes the blood vessels in our heart and skeletal muscles to dilate, but it causes the blood vessels to our kidneys and digestive tract to constrict, is because the adrenaline receptor sites are different. So in fact, we've asked you to know that the adrenaline receptor sites on the blood vessels of our skeletal muscle and heart are called beta 2. They are the same type of receptor site as on airways that cause airways to dilate. But the adrenergic receptor sites on all the other blood vessels of the body are called alpha 1. That's the Greek letter alpha. Now again, if you actually look at your book, you'll see that there's alpha 1, alpha 2, alpha 3, beta 1, beta 2, beta 3, and they're still discovering more things. So it gets a lot more complicated. I'm just giving you a few examples. So it's not that the neurotransmitter is different, it's the same neurotransmitter, but the receptor sites are different. Just like we learned that the acetylcholine receptor sites on skeletal muscle are different than the acetylcholine receptor sites on internal organs like the heart. Nicotinic versus muscarinic acetylcholine receptor sites.
Are the alphas still adrenergic?
All of these are adrenergic.
Oh,
They're subtypes of adrenergic. Just like nicotinic and muscarinic are two types of acetylcholine receptor sites. Alpha 1, beta 2, anytime you see that, and I'm sure you've seen these terms before, are types of adrenaline receptor sites. That's how we classify. Incidentally, I'm not covering this in our course. There are multiple types of dopamine and serotonin receptor sites and endorphin receptor sites. They're not all the same. So this whole subject pharmacologically gets much more complex. All right, now, we're now diverting the blood to where increased flow of blood to where we most need it during stress, exercise, emergencies, reducing it to where we could get by with less. Overall, our blood pressure rises. The fact that our heart is pumping blood at a faster rate through the vessels of our body, in part, raises our blood pressure. So during stress, your blood pressure rises. Now, another thing your sympathetics do, they innervate your sweat glands and they cause increased sweating. So our first thought is, yeah, like why does that happen? Well, because since a stress state is associated with increased cellular respiration, didn't we learn back in section B that when you break apart sugars to make ATP, more than half of the energy, 60%, goes off as heat? And we don't want to risk overheating and die from overheating because of all that heat produced in cellular respiration. So we got to continue to cool ourselves off. So this is why when you're stressed, right, don't you sweat? Right? Anytime you're sweating, certainly when you're exercising, that's stress, you're sweating. But also, even when, if I really frightened you, you don't think you'd break out in a sweat? Okay, so this is just what happens. Now, another thing that happens is the sympathetics, the autonomic motor neurons, innervate the iris of our eye, and the sympathetics cause the iris muscle to contract, which dilates the pupils. And the clinical term for pupillary dilation is mydriasis. So again, in case there's any question, like, do we have to know the word mydriasis? 100% yes. Okay, I shouldn't even have to say this by now. You know that if I'm saying it, you have to know it. Because there's plenty of stuff I don't say that's in the book that I'm not asking you to know. But I wanted to be no doubt about it. So nobody would say, well, you didn't say we had to know that. I said you have to know it. All right, so the pupils dilate. How can we explain that? Perhaps, at least in part, dilating the eyes takes in more light, gives us a better view of the world. Because in an emergency, in a stress situation, in fear, we need to be very alert and aware of the world and see it crystal clear compared to when we're relaxed and we're not worried about anything. We don't have to see quite as clearly. Now, I mentioned earlier that all of your air passages dry out. And we're not going to worry about digesting a meal in an emergency situation. So there's decreased salivation, your mouth goes dry. I think I mentioned last class meeting that if you've had to get up in front of a class to give a speech, that was stressful, and your mouth kept going dry. No matter how much you drank the water, it just immediately got dry again. Just couldn't, nothing would help. There's a decrease in GI motility. We're not going to worry about digesting our meal in a life or death situation, and or when you're exercising. And I think we mentioned last class meeting that your mother probably told you that when you've just eaten a big meal, don't go out running, don't go swimming. Anybody ever hear that? And your mother was absolutely right, because you can't both digest your meal and exercise at the same time. Because the moment you start exercising, you divert the blood to your skeletal muscles and you decrease the blood flow to your GI tract. You're just not going to digest it and absorb your meal. It just sits there. Once you stop exercising, then your body can go back and digest the meal.
Is that the same when you get angry or feel some stress? They say your food goes down in lumps?
You're just not going to digest it. It's just going to sit there. So, you know, this idea that if you were eating a meal and you're really stressed, it's just like interferes with the whole digestive process. I mean, what you should do is you should have, if you're going to have a large meal, it's one thing if you're having a yogurt, it doesn't matter, but if you're having a nice large meal, you know, you should be relaxed, have some wine, you know, chill, lie down on a couch, you know, go to sleep. You know, at the very most, just take a slow walk, but nothing stressful. That actually helps you digest the meal. You don't go after you've just eaten. Nobody does this. You don't eat a big meal and say, I think I'll go to the gym right now. That'd be ridiculous. You're just going to hurt everywhere. Nothing's going to work right. All right, now what we wrote next here is apparently the moment you're stressed, if you're a guy, you ejaculate. I'm going to come back. That's not quite true. I'm going to talk more about that in a little bit. Overall, we said that there's no autonomic motor neurons that go to your brain. They go out to the heart, the salivary glands, to the stomach, the blood vessels. But we did say that the adrenal medulla releases epinephrine, adrenaline, into the bloodstream, which can be carried up to your brain, and it's an excitatory neurotransmitter in your brain that makes you more alert. So I put this in brackets. It's not really that the sympathetics are going to your brain, but by releasing epinephrine into the bloodstream, which is carried up to your brain, it makes you more alert. In a stress state, you certainly become more alert, right, and more aware of what's going on than just before you became stressed. When I slam this down, if you were relaxed before that, and once you're frightened, you become really aware of what's going on. Okay? All right, that's the sympathetic. Let's summarize the sympathetic state this way. Actually, let me just point this out. I may have done this last time. While it is true that the sympathetics raise your blood sugar level, raise your fatty acid levels, dilate your airways, increase your heart rate, raise your blood pressure, increase your sweating, the sympathetics decrease bronchial secretions, decrease salivation, decrease GI motility, and inhibit emptying of your bladder. So, and I have to talk more about that momentarily. But so it's not true to say sympathetics increase everything. Yes, they probably do increase more things than they decrease, but they do decrease certain things. That's why I said last class meeting, we can't just say sympathetics increase everything, but I think it makes perfect sense in terms of context. What do you think you should increase in an emergency situation, and what things could you decrease? And in that respect, I think we're designed exactly the way it makes perfect sense.